So today we will talk about the chickenpox, which is also known as varicella. So chickenpox is an acute and highly contagious viral infection that is caused by Varicella zoster virus. And chickenpox is characterized by generalized itchy vesicular rash that appear in the palm of crops, means that they are present at the same time in different forms. And chickenpox is mostly transmitted to respiratory droplets or aerosol permanent infected person, and they are also transmitted by direct contact with fluid from the skin vesicles. And the patient of chickenpox is contagious for about 1 to 2 days before the rash until all the lesions have crusted over. Next is the incubation period. So chickenpox has an incubation period of 10 to 12 days, and on average, the incubation period is around 14 to 16 days. Next is the clinical picture of a patient having chickenpox. Initially, we have the prodromal symptoms in which the patient have low-grade fever, malaise, fatigue, headache, and loss of appetite. And the signs include rashes that appear in different form all over the body. So the clinical features include extremely itchy rash, fever that is low grade, abdominal pain, swollen glands, and headache and fatigue. Next is the rash and the chickenpox. So chickenpox is a characteristic rash that start on the face, then on the scalp, and then spread downward toward the trunk and the lower body. And the lesions of chickenpox appear in different crops. Initially, we have macule, which then become papule, and the papule is converted to vesicle, and the vesicle become pustule when pus is collected, and when the pus or pustule rupture, then a crust or scape is formed. And these lesions are intensely itchy in nature, and a key feature is the presence of lesion at different stages simultaneously. So the stages of chickenpox which include macule. Initially, we have a macule, which is a plate red spot, which then become papule, which is a raised lesion, and the papule become vesicle, and vesicle is a fluid filled blister. And when a pus is collected in the vesicle, then it is called as pustule, and when the pustule rupture, they form a crust. Next is the investigations done in chickenpox patients. So chickenpox is usually a clinical diagnosis, and if the confirmation is required, then we do PCR of the vesicular fluid, which is a paper and confirmatory test. Similarly, we can also do a Varicella zoster virus serology, which is useful in selected cases, and it is done particularly to assess the immunity of the patient. And CBC is done, but it shows non-specific changes and it is not diagnostic. Next is the management of a chickenpox patient. Initially, we do a supportive treatment in which we advise the patient bed rest, maintain the hydration status. We advise fluids, either oral fluid, and if the patient is unable to take orally, then we advise IV fluid. And similarly, for fever, we give antibiotics, that is a paracetamol, and for severe skin itching, we prescribe antihistamine. Similarly, we can also give the calamine lotion, and we advise the patient to avoid scratching of skin. And similarly, we advise the patient to maintain a good skin hygiene to prevent the occurrence of secondary bacterial infection. And we also avoid aspirin in children because of risk of Reye syndrome, and insects are also avoided, particularly in case of the children's. And in severe cases, we also give antiviral therapy for chickenpox, and the antiviral that is given is known as acyclovir. But acyclovir is given in case of severe disease or when there is a risk of development of complication. And acyclovir is effective when started within the first 24 hours of the rash onset. And if the disease becomes severe, then we can also give the acyclovir in IV form. And at last, we will talk about the prevention of chickenpox, that how chickenpox is prevented. So we can give the patient varicella varicella vaccine before the occurrence of disease, but a patient who have significant exposure are having contact with a high risk patient, then we give the patient varicella zoster immunoglobulin. So it was all about the chicken pox and its management. Thank you.